Fascinating work happening, a lot of it out of Cedars-Sinai. So there's a physician leading a lot of their virtual, mostly virtual, some augmented reality, but really building on the whole digital therapeutics trend. So Brennan and his team, I think, have seen virtual reality opportunities around pain management, around weight loss. I think even when I talked to him about a year ago, there was even some things they were doing around people having a baby, so tied back to the weight loss, and how you could use virtual reality in the mental health world. So both from a calming, PTSD type of perspective. So I do see a lot of hope in that space, particularly. There's some interesting things happening, especially outside the US around robots in terms of, robots being able to serve as a caregiver, help people that have limited mobility. We know people traditionally really prefer to age in the home. So, are there things that robots can do there? I think there's also, if we think about, pharmacies, especially as we move to more and more central fill from a retail perspective efficiency, are there ways for I think we all think of robots as, walking around and doing stuff, but there's lots of robotics that just can fill a bottle, can fold a bag up, can screw a cap on, all the things that can be done to make that, more efficient. I do think those will continue to push as we get pressure on efficiency of care delivery in the US and other places. Just how do we continue to drive down costs? I think drones will be interesting. I would say to date, drones have mostly been a cool kind of demo for people to show off. I think if we progress, I don't know, 5, 6, 7 years, and you think about intelligent mailboxes that can receive drones and can control the temperature within the mailbox and put those in the right rural locations, drones can become much more effective. I don't think you're going to start dropping a $200,000 cancer medication via a drone, but if you're putting a $10 generic medication on a drone that's fairly light and can get it to a rural location, I think really interesting. I think if you see some things where there's, I looked a couple of years ago at could you do some things from like a Narcan perspective and a opioid use disorder to get something delivered very quickly from like a 911 type of service delivery to a very specific incident. And so I think you're going to continue to see some unique use cases, and at some scale over time, this address some basic distribution and rural challenges.